everyone, my name is Ritika Bose. I am your host and we will be discussing about cervical cancer. Cervical cancer is the second most prevalent cancer among women in India. January is observed as Cervical Cancer Awareness Month. This year the theme is Learn, Prevent, Treat. We will seek expert advice from Dr. Pakhi Agarwal and we would like to know more about cervical cancer from you.
Right. Thank you, Ritika, for having me. Now, cervical cancer, as she already pointed out, is the second most common cancer which is plaguing Indian women today. When we say cancer, it basically means an abnormal growth of the cells, which is different from how cells normally divide and multiply. And when this cancer affects the neck of the womb, or the cervix as we call it in medical terms, we term it cervical cancer. Now, that's what cervical cancer is. It's an abnormal growth of cells in the cervix, which normally should not be doing what they're doing.
What are the symptoms of cervical cancer?
Right. So now cervical cancer is one of those cancers which has a very long pre-cancer stage as well. When it's frank cancer, the symptoms are slightly different from when cancer is developing silently inside the cervix. And it's important that we are vigilant about these symptoms because these are the ones which are going to lead to early detection, which is going to drastically change outcomes. So some of the symptoms of early or pre-cancer are you could have bleeding after intercourse, you could have unscheduled bleeding between your cycles, you could have a chronic vaginal discharge that does not go away and does not respond to common medicines. And of course, you could have other symptoms which happen with advanced cancer, which are pain in the abdomen, difficulty in passing urine, difficulty in passing motion, or feeling generally unwell and losing weight.
Doctor, what causes cervical cancer?
Excellent question. So now we know from our knowledge of medicine that cancer of the cervix is very largely linked to infection by a virus which we call as the human papilloma virus. And almost 90% of the cancers can be attributed to this virus. But other than that, there are certain other risk factors to develop cancer, which are having a poor genital hygiene, having multiple sexual partners, not practicing safe intercourse, being immunocompromised for any reason, and not undergoing timely treatment of precancerous lesions.
How can one prevent cervical cancer?
Now, prevention is the key when it comes to any cancer, and cervical cancer is not far behind. We know that prevention can be broken down into simple steps. We call them as primary prevention, as secondary prevention, and as tertiary prevention. Primary prevention simply means that you are acting before the risk factors have taken a hold in your body. Now, the risk factors for cervical cancer, like I said, one of the common ones is HPV infection. So when we talk of primary prevention, we are talking about preventing HPV infection, which is possible now with the occurrence of a vaccine, which is called the HPV vaccine, which has been around for the last more than 15 years. Of course, has made its way to India as well. So that comes under primary prevention, HPV vaccination. When we talk of secondary prevention, it is prevention in women who already have the risk factors, but we are trying to detect cancer early. Herein comes the role of what we call as a screening test or a pap test. So all of you may have heard of the pap test. Anyone who is of the eligible age should have a regular gynae checkup and present themselves to a regular pap smear testing to be able to detect this cancer, especially in the precancerous stage. And when we talk of tertiary prevention, it is in women who have developed the precancer. We are detecting it early and we are treating it early. And we do that by means of special devices which we call a colposcope. So that in a nutshell is what prevention of cervical cancer is all about.
But as you mentioned about HPV vaccination and pap smear, at what age should one take HPV vaccination?
Right. So HPV is a virus which is sexually transmitted, i.e. it enters the body with sexual intercourse. So the ideal age to vaccinate is before the onset of sexual activity. And the WHO and various guidelines across the world have deemed that the age group between 9 to 26, based on various cultures, is the appropriate age to go ahead and get vaccinated. And within this spectrum also, we say that if we target girls between the age of 9 to 15, and this includes boys also in other parts of the world, so eligible children up to the age of 15, if they undergo this vaccination, then the protection from this virus is upwards of 95%.
At what age, doctor, do you suggest that one should take their first preventive cervical cancer test?
Right, so when we talk of the pap smear test, it is generally begun after the age of 25 and it goes on up to the age of 65. This test is carried out 3 yearly. Now many annual health checkups offer this test yearly as well, but there is no great advantage of screening more often than needed. So if at all, you must have a test every 3 years. And if we offer HPV testing as well along with this test, so we do a pap and an HPV test, then this screening interval can even be extended up to 5 years. So if you have a screening once in 5 years and it is normal, that means you can be reassured that your risk of developing cancer is extremely low. And also the starting of this test, although I said it is 25 years, in populations where sexual activity starts much earlier, we say that somebody who has been sexually active for at least a year can go ahead and have this test.
Doctor, if someone is detected during pregnancy with cervical cancer, can they go ahead with that pregnancy?
Yes, that's a very pertinent question. We are seeing cancers occurring more often now in younger women, and these are the more aggressive cancers. But yes, if cancer does occur with pregnancy, we take a lot of factors into consideration. How advanced is the pregnancy? How precious is the pregnancy? And what is the stage of cancer? And based on that, there are some therapies which can be safely administered in pregnancy. In the second and third trimesters, it is okay to take chemotherapy if it is needed to shrink the cancer. And if surgery is needed and we know that the pregnancy is sufficiently advanced, then surgery can be planned along with delivery as well. So this is an area where we do a kind of a multidisciplinary approach to the treatment, discussion with radiation oncologist, medical oncologist, the primary care physician, the gynecological oncologist to decide what would be the optimum time to optimize the patient's health as well as her pregnancy.
Doctor, is it transmissible from the pregnant mother to the baby?
Well, no, cancer cannot be transmitted like can certain other infections. So it is not a cancer that if a mother had it, the baby is going to get it by means of in utero transmission. But having said that, there is a 5% genetic component to cancers that we are now detecting. So 5% of cancers can transmit in families due to faulty genes. And the genetic aspect of it is what is transmissible, but not a direct transmission of the cancer from the mother to her baby.
Doctor, what message would you like to give to women for their overall well?
Right, so I would urge all women who have never had a pap test to read about it, meet your gynecologist, ask for the test. I would request those who are of the eligible age, who have daughters who are teenagers, to read up on the vaccine, find out its benefits other than those that I have already highlighted. And if you are convinced enough, then yes, go ahead and meet your doctor and get vaccinated. And if you have been detected with a problem, don't be scared. Don't think that it is the end of the world. There is medical care has advanced by leaps and bounds, and there is treatment for every problem, even cancer.